when to do renal transplant, indications and contraindications. When life is not possible to sustain without renal replacement therapy, the you go for the best one is the transplant. Transplant is essential when the you have the GFR less than 15 ml, more than less than 10 ml, less than 8 ml per minute per square meter, 1.73 meter square. They when you have the symptom of the renal impairment, that is your life is not possible to sustain without renal replacement therapy. So there are certain this is the only indication, and contraindications when you won't do it when life is limited by other reasons. For example, a cardiac severe sort of cardiac disease or disseminated malignancy, terminal sick patients. Your patient is on ventilator support. You are not certain about the long-term ventilation. You are not support about the. No, you are not sure about the outcome. Two, three. When the malignancy, COPD suppose in the chronic interstitial lung disease, chronic liver disease, and plenty of other diseases, including the brain, when you are certain that life is going to be curtailed for other reason, then you think twice before going to transplant. So active infection, you wait until infection is cured, or malignancy. You also here you can wait and see whether malignancy is better, at least for time being, at least a time good amount of time. You do not have much higher amount of relapses. So until unless it is being ensured, you don't go for the transplant. Other way, the preemptive transplant on the other extreme end, then when you are certain that patient is benefited by transplant, but you are certain that the GFR is going to fall below 8, 10, 15, something. So, and he will be needing transplant. How is polycystic kidney disease, autosomal recessive polycystic kidney disease, and Alport, IgA nephropathy, some of the other diseases where the frequent security is almost universal and distress is almost universal. So you can think of doing the preemptive transplant because it is good compared to dialysis, and because dialysis is money and physical exhaustion. So you can go for a transplant. B virus, C virus, hepatitis B, C, HIV, BK polymer virus, and the most important is the poor adherence, socioeconomic, the person's outcome, your they are the relative contradictions of doing a transplant. Transplant benefit is 20 to 25 years in a good amount of time, and in children it is said that 2 to 3 transplant in a lifetime of a child can give rise to the near normal or near normal quality of life, near normal tenure of life. So thereby, so encourage people to do a transplant when he really need it desperately, almost certain to need it.